Hi guys, thank you so much for joining me one more time. And today I'm going to talk about advanced techniques, and this is part 5 of the series that I'm doing on the treatment of chronic stable angina. So basically, after you have a patient who you've already determined has chronic stable angina, you go through the algorithm and you try lifestyle modifications, you do risk factor control, you treat with drugs for mortality benefit or symptom relief. And if you've exhausted all of those options and the patient is still not improving, then you've got further decisions to make. And the decision that you have to make is, when are you going to perform coronary angiography? Now, basically, there are two big indications for coronary angiography. If you have chronic stable angina and despite maximum medical treatment, you continue to have symptoms, and your symptoms are to the point that they are interfering with your quality of life, then that's unacceptable. At that stage, a decision has to be made that we need to get more aggressive with treating your underlying disease process. So you may be a good candidate for coronary angiography, because if you are having chest pain every time you walk to your mailbox, or you're having chest pain every time you walk to the end of the street you live in, that's just not something that you can sustain, and it will your quality of life will be affected. So we need further aggressive management. And so the cardiologist is going to perform a coronary angiography, and what they're going to do is that they're going to do a fractional flow reserve testing. So after they have done the fractional flow reserve testing, if they determine that the lesion is hemodynamically significant, then at that stage, the cardiologist can place a drug-eluting stent, open the lumen of the artery and to restore the blood flow. And so this procedure is called PCI, or percutaneous coronary intervention. Now, if you have one or two arteries, you can place a stent in them. But what we've found as physicians is that if there are multiple coronary arteries that have the plaques and lesions in it, sometimes a bypass surgery will be more effective than just doing a PCI. So in those cases, the patient will have to undergo a full cardiac bypass surgery. Also, it has been found that patients who have diabetes and who have some left ventricular dysfunction, bypass is much more effective at improving the quality of life and even mortality than doing a percutaneous coronary intervention. So these decisions will be made at that stage. All right, so with this lecture, I've finished this series, and I really hope that you've enjoyed it. Please subscribe to my channel. I hope to see you in my future videos. Thank you. Okay, bye.